Hi Ellen, it's Kim. I wanted to make this video for you because I am in Washington, D.C. with my daughter right now, Teagan, and she's having a very difficult time. She does not feel well at all, and she's very emotional and sad, and it's just heartbreaking to watch. So I am making this video for you to tell you a little bit about who Teagan is. Teagan is a 7-year-old beautiful girl who loves animals and is just everything I could have always asked for in a daughter. And when Teagan was born, she was diagnosed with something called eosinophilic esophagitis, which is a very painful condition of the esophagus in which the body attacks itself against food, and it affects the esophagus. So originally Teagan wasn't able to eat anything. She had to just stick to a specialized formula. And over the past 7 years, she has worked up to being able to eat 6 foods, and that's it. She can have 6 safe foods that we know of. A couple of them are questionable. And when she does have a reaction, when she eats something she's not supposed to, or it could even be an environmental allergen that she's exposed to, or latex, she develops severe nausea and vomiting, abdominal pain, chest pain. She gets food impaction where she feels like there's a coconut in her throat and she can't swallow. She gets intestinal problems. And for her, she gets headaches, she gets joint pain, and occasionally fevers. And these symptoms can last anywhere for a couple of days to months at a time. 90% of the time we end up in the hospital because she is dehydrated and malnourished. So it's very painful. It's very scary for her to try anything new. And socially, it's been horrible. You know, imagine a little girl not being able to eat at birthday parties, to have a normal lunch period at lunch with school, even to go on a trip. We're here in Washington. I had to bring all of her utensils, all of her pots and pans, because she can't have any cross-contamination. She has to have all of her own food. We can't just go to a restaurant. She's never been able to eat at a restaurant. We can't just go for a walk down the street of Washington and go to a stand and order something other than potato chips. She just feels socially awkward, and it's very difficult for her. And then on top of that, 3 years ago, she started developing some psychological issues like OCD and separation anxiety. And we literally kissed our child and said goodnight one night and woke up the next morning to someone that we did not recognize at all. Her eyes were black, her pupils were so large. She was not present. You would talk to her and my daughter was not anywhere there. She was not listening. She could not hear anything. Her OCD was so bad that a leaf would blow outside and she would go into a rage and want it put back in its place. She started hoarding things. She wanted to keep everything. She refused to shower because she wanted to keep all her germs. She became incontinent all of a sudden. She became depressed. Her separation anxiety was so bad. She could be sitting on my lap and every 20 seconds have to look back and make sure that I was still there. Her memory became bad. Her motor skills were off. She could no longer recite her ABCs. She could no longer write her name. And she was in daily 24/7 violent rages. This little 5-year-old girl had to be restrained by people. She was so out of control, and we had no idea what was wrong with her, but we knew our daughter was missing. She was gone. We took her to hospitals. One of the hospitals, the main hospital, diagnosed her with a psychological disorder. They put her on very high doses of antipsychotics, antidepressants, and they literally punished her. She was afraid to eat and drink. That's one of the symptoms of what we now know is PANDAS. We did not know then, but they would give her 5 minutes to drink something, and if she didn't, they removed her Christmas presents and her birthday presents from her room. They refused to let her leave her room, and they threatened to have me removed from her care. She also was not eating or drinking anything, so we begged them to please give her a G-tube, which her specialist for years had recommended, but they also refused to do that for a, quote, behavioral child. Instead, they put an NG tube down her nose and into her esophagus, which was already damaged, and she immediately started vomiting blood. They didn't sedate her for this. They didn't tell her what they were doing. The whole experience has left a huge amount of PTSD in my daughter as well as the rest of my family. She was discharged from the hospital eventually. She had to go to outpatient psychiatric care, and she very quickly developed a very high heart rate and vomiting, and also developed 2 ear infections from the amount of reflux she was having. So she had to be readmitted to a different hospital. They found out that she has something called serotonin syndrome from all the psychiatric medications that this hospital put her on, and that she was also having an allergic reaction to the actual material of this NG tube. So they did the right thing and put her on antibiotics and steroids, and for the first time we started seeing my daughter come back. Her psychological symptoms started fading away. And that was the first time that we heard of this thing called PANDAS. It is spelt like the cute little panda out there. It is in no way, shape, or form cute. Basically what happens is an infection passes across the blood-brain barrier into the brain, just like strep would do to the heart, causing rheumatic fever. This is the same thing, but it attacks and invades the brain. So she had this infection and inflammation going on in her brain this whole time, that she needed steroids and antibiotics to help. So we took her off of all these psychiatric medications that were making her worse. We tried to get her on the right track with the right doctors, but by that point, so much time had gone by that she was misdiagnosed, that she needed something called IVIG infusions. It's basically a form of plasma, and in very rare cases, a patient can develop aseptic meningitis with it. And Teagan is a very rare case, so she developed that. She got intense migraines, needed to be in the hospital getting morphine. So the doctors, even though this was working, could no longer continue it. So for a year, we kept her on anti-inflammatories. She was on an antibiotic. She still is. It's been over a year. And she had some good times, more bad times than good times. If she is around anybody who is sick, if she gets sick herself, she develops this flare. And also she is unique in the fact that with her EOE reactions, since it is an inflammatory process, it triggers her PANDAS. So she's had a very difficult time. She really hasn't been able to attend school. She's fallen very far behind. She has major memory issues. She has episodes where she just goes into a full-blown rage and then cries for hours, either not remembering what happened or feeling so bad like she is a bad girl and she just can't control herself. She's gotten to a point where she feels so socially isolated and so frustrated with where she's at in life that she has made suicidal comments. She wishes that she was never born. And for a mother, this is obviously heartbreaking to hear. So we found a doctor to help who is in Washington, D.C. She is a neurologist that does a lot of work with PANDAS or really what's called autoimmune encephalitis. And this doctor has put Teagan on a form of chemotherapy called rituximab. Teagan had her first infusion a few weeks ago, and unfortunately things tend to get worse before they get better. So we saw a lot of symptoms that were present 3 years ago that we haven't seen in a long time come back. So for her safety, I came back to Washington with her sooner versus later. I also have a 4-year-old and a 2-year-old at home, so I really needed to get her out of the house. And we've been in a hotel. We've been waiting for her next infusion, which is in a few days from now. But during this period of time, she has also developed an EOE reaction. So not only is she having these horrific PANDAS symptoms, but she now is having nausea and vomiting and food impaction. So she's having a difficult time eating. We have her on prednisone for that, but now she's on prednisone and a form of chemotherapy, so her immune system is just all over the place. And prednisone itself has a lot of side effects. So she's moody, she's irritable, she cries for no reason, she doesn't feel good, she's exhausted, she's pale, she's white as a ghost. It's very difficult to watch. It's difficult to watch your child suffer like this and really not be able to help. There are times you just want to hug her, and she's so sensory stimulated that she can't handle that. So the best you can do is just be with her and try to talk her through the process. So we are here waiting for her next infusion. One of the other parts of this is that this is kind of a controversial diagnosis, and insurance companies don't know a lot about it yet, so 90% of all her care has been out of pocket. We have had a GoFundMe site set up now for 3 years, and it covers the ongoing needs that she has. Her doctor's appointments, she's got doctors in Washington, in New York, in New Jersey, in Boston. We live in Massachusetts. All of them we need help paying for. All of her treatments, her medications, her care. We've been unable to get caregivers at home because due to mass health or whatever regulations, she's still able to bathe herself and dress herself, so we don't fit the criteria. I'm fighting with the insurance company right now to cover this form of chemotherapy for her, and so far I've had no luck. So it's an ongoing battle. The amount of caregiver strain that this has been compared very much to a child with cancer. I have had to quit all of my jobs. I'm a nurse and have had to quit. It's beyond anything I can explain. It's a daily challenge and struggle in so many different ways. So I am sending this to you. Teagan loves animals. She wants to be a vet one day. She wants to own her own farm. She has a therapy cat, Blaze, at home, who has been a godsend. He was sent from heaven. I can't explain this cat, but he is everything. It's hard for her to be in Washington without him. We also have other animals. I think we're up to 13. They're very much her comfort, and she knows how much you love animals, and she watches you all the time. She loves to watch you dance. She loves to watch you talk about animals. It is her dream to meet you. So I am sending this to you with the hope that that could possibly happen. My daughter has been through so much at 7 years of age, and she needs something happy in her life. So that's why I am sending this to you, especially now where I am just stuck in a hotel room crying and not really knowing what to do. So that's my story. Thank you. Oh, wait a second.
Hi.
There is the little princess. This is Teagan. Say hi to Ellen.
Hi.
We hope to meet you someday, Ellen.
Uh-huh.
Bye.